On this episode, Gerardo brings out the big guns to try to help Hector.
If I'm not careful, I could potentially cut skin or even cut bone.
I know, don't worry, come on.
Kate tries to find out why new pup Rufus is so unwell.
Bad.
And grumpy Rubens,
The two of you get in there and just do the tough love.
not happy about a visit from the Shens.
Oh, hello. Okay, baby.
You make my world a better place.
Come on, there's your girl.
I can't depend on you.
Hey guys,
On the Gold Coast,
who do we have here?
Hector, our little cockatoo.
Gerardo's slightly nervous about his first patient, brought in by Anna and her mother Delmy.
I was terrified. The only cockatoos that we see are wild ones that come in and they are super scary. Oh. Okay, you can hold on. What's going on with Hector today?
He's been a very healthy bird, never have any problems. This is the first time we actually bring him to a vet.
Oh wow.
Been with us 31 years. I got Hector from a sanctuary when he was only just 2 months. And we've never been without him in the house, ever. He's got a ring on a foot that it's been giving stress to him. The foot just actually can't stand on the
Oh, okay, so Hector doesn't actually want to put weight on the foot as well. He was having trouble perching, and the owners think it's because of the identification ring that is around his ankle. You can see there's a bit of swelling around there, isn't there?
Yes.
Pressure. Okay.
I think that's actually has affecting my baby.
Gerardo now notices Hector has another serious problem.
The feather chewing and stuff has happened at the same time, is that right?
Yes, they're starting to lose feathers,
Yeah.
so it was a bit stressed.
The ring is actually causing him quite a lot of discomfort. The plan today is to remove that ring from Hector's ankle.
We love him so much.
Pain?
It's okay, my
Pain? A short little procedure and then you'll feel a lot better, hey?
Oh, yes.
You want to get...
Gerardo's gonna look after you.
That's right. This is possibly the nicest cockatoo I've ever met. Despite his big beak and sharp claws, Hector was a sweet cockatoo.
You'll be good, all right? I'm not abandoning you.
Luckily I wasn't getting bitten. It's all right, mate. I'll take care of you today.
At the Bondi Veterinary Hospital, proud new pup mum Sarah has brought in her 11-week-old golden retriever Rufus to see Kate.
We met him first at 4 weeks old, and then we got him at 8 weeks old. So he's a member of our family. And yeah, we just want him to be well. My husband and I don't have children, so this was going to be our little baby. And we've been...
Oh, Rufus. Hello, Rufy, how are you? Most people around here know that golden retrievers are definitely my favourite dogs. I wouldn't have anything else. And I always say to people, everyone in their life needs a golden retriever at least once. What's been going on?
We think he's peeing too much. He pees and then he pees again and then he pees again.
Come on, let's have a look at you.
Come on, baby. He's eating, he's drinking, there's no problem there.
Yep.
But there's the constant squatting.
And do you reckon he's been lethargic?
Yes, definitely. We've noticed that, and the drooling is...
The drooling. I've seen Rufus before, and that dog is usually bouncing off the walls. It's a fast little heart. It is, isn't it? Why is it so fast? I'm not sure. There's a whole bunch of different signs that are really not related to just the straining to urinate. The fast heart rate, the not wanting to eat, the lethargy. Doesn't make any sense. So I'm going to keep him here with me. We're going to run some bloods on him. Let's just get a blood panel down. Don't stress. He'll be safe and sound here, and I will call you as soon as I know something.
Great.
Hey, this is Rufus. Isn't he cute?
Hi.
Oh, he's sick. He's sick.
I don't know what's wrong with him.
I don't know what's going on. So he's straining to urinate. I need to get some blood off him.
Okay.
I don't know what's wrong with him at this point, honestly.
Good boy, Rufus. It's okay.
I'm going to send these off as an urgent. These blood results are going to tell us quite a lot and give us a little bit more pieces of our puzzle so we can actually hopefully find a lead that we can follow through. There you go. Good boy. Good boy. I'll see you in a bit, okay? Come back and get you in a minute.
Okay, here we are.
In Sydney, Audrey and Alison are answering an SOS from a worried cat owner.
She's found all these horrible lesions all over its face. We don't know if it's a scratch.
All over its neck and its ears.
And whether it's flea problem, so we'll go check it out.
Mickey, where are you? Come on. The vet's going to come now. Come on.
Amber has 2 cats, 19-year-old Rubens and 10-year-old Mickey.
Hi, Amber. Hi. Good. Come in.
Here to see Mickey. He's not well.
No, poor thing. Mickey's about 10 years old and we've had him since he was a kitten, 6 months old. He belonged to a neighbour but he decided he liked us better.
Your vets are here, Mickey.
He's probably hiding. I'm sure
Where
he's
are
hiding.
you?
I'm sure he's around here somewhere.
So we get down on our hands and knees. Oh, yep, there he is.
Shy Mickey knows something's up.
Oh! There he is.
There we go. Oh. So we get the cat out, we pop it on the table and we give it an initial check.
And so how is he in himself? Is he eating and drinking okay?
That's fine, that's normal, but he's just miserable. He's just lost his joy for life.
I think we're going to have to take him out to the van, have a really good look at these lesions, maybe take a sample as well. And he's getting a little bit stressed. So we'll pop him in his carrier and we'll carry him out.
Be interested to see if it's fungal. You want to stay in there? It does look very comfy. All right, Benny, let's have a look.
This looks unusual, doesn't it?
It looks like a secondary infection to an allergy, something like that. I'm just having this.
Very itchy, buddy, aren't you?
So we got Mickey into the van and we're having a really good look and it just looks nasty. It's weepy, it's scaly, it looks very sore. So we take out our UV lamp.
Okay, let's shine this UV light on. Oh no.
Look at that.
Look at that lesion.
I know, don't worry, come on, don't worry.
In Bondi, Kate is trying to work out why new pup Rufus is so lethargic and having trouble weeing.
Bloods are back for Rufus.
Oh my gosh, bad. Anemia, bad. We've got high this, low that, none of which is piecing together at all. All of them abnormal, and that is making me pretty darn worried. What else have we got? Cortisol. Why is cortisol so low? Has he got Addison's? Addison's disease is where you don't have functional adrenal glands. That is, the hormones that are secreted from your adrenal glands are not being secreted, and that's life-threatening.
Rufus's worried owner Sarah is waiting anxiously at home for any updates about her precious boy.
Hello, Sarah. Rufy's fine, but I did want to let you know that the bloods have come through and there's quite a lot of abnormalities in these bloods. What we need to do sort of as a priority now is that we need to actually do an ultrasound. So I've got a specialist coming in this afternoon and we'll know a little bit more after that. So I'll keep in touch.
Kate's hoping the ultrasound will provide more clues about Rufus's puzzling blood results and rule out deadly Addison's disease.
So what's happened with Rufus?
So little Rufus, he's been straining to urinate.
Yes, it's always a worry if they're having trouble urinating. So yeah, we need to check that out.
Specialist Dr. Michael Linton will be performing the ultrasound.
So I'm having a look at his bladder first. What I'm looking for in a case like Rufus is there a functional obstruction or something blocking the ability for Rufus to urinate, whether that be a little bladder stone, whether that be a growth of some sort from a polyp to a urinary tract infection. So we can just see here, there's a little, thickening there, and that's the point where the ureter, which I can see the little tube there, actually goes into the bladder itself.
It's not clear if the thickening in Rufus's bladder is caused by infection or a structural abnormality. So as a precaution, the little pup will be started on an immediate course of antibiotics.
What's wrong with you? You're like a puzzle. I know, you're like a naughty, cute puzzle.
Kate is still hoping to rule out deadly Addison's disease and now wants to do another important test.
I'm going to run an ACTH stimulation test, and that's a specialised test for Addison's disease. And give him chicken treats at the same time. Thanks, Dr. Angela. I'm definitely going to get to the bottom of this. I just want him to be okay.
Okay, Hector, it's time. We're not going very far, we're just here.
At the emergency hospital, Gerardo is about to try to remove a metal ring that's biting into Hector the pet cockatoo's ankle.
I'm going to give you a little bit of anaesthetic gas, and then we're going to take that ring off your leg. Okay, good boy, Hector. There we go. In the beak. There we go. Oh, fit, perfect. With the oxygen going on. Yep. This is where he's been feather plucking.
Gerardo suspects stress from the painful ring might also be causing Hector to chew his own feathers.
Now what I need to do is remove the ring without causing Hector any more trauma. It's actually starting to dig in. So every time he bends his ankle, I think it starts to put pressure there. The ring is in the shape of a C and it's not welded. So hopefully I can use pliers and pry open the ring without having to use anything to cut it. Oh yeah. See how much we loosened it. Oh, that's loosened.
But not loose enough. It's time for some heavy-duty equipment.
Trusty bolt cutters. If I'm not careful, I could potentially cut skin or even cut bone, and that is something we definitely don't want. You ready?
Yeah.
Okay. Closing down. Oh, be super careful here. We don't want to catch anything. 100% certain? We're certain?
Go.
Cutting down. Close your eyes. Oh, done. It looks okay, doesn't it? Hector's leg looks perfect. There's no penetration of the skin there. I can see that there is no injuries that require me to administer any medications or anything like that.
Okay, darling. Okay.
Oh, did he wake up already? Yeah. Oh, it's okay. You're like, what? What happened? Where'd it go? Hey, it's all gone. Okay, I'm gonna put you to bed for a little bit, mate, and then you can slowly wake up. Hey, Hector. There we go.
Oh no.
In Sydney,
Look at that lesion.
Audrey and Alison are checking nasty skin lesions on 10-year-old Mickey.
Look at that border, the periphery just glowing there on the hair.
The fact that it's doing that on the newest lesion and around the peripheries.
So these lesions are glowing. There's a bright green colour around the edges. It's definitely a positive for a fungal infection called ringworm.
Oh, buddy, look.
Buddy.
That's impressive. So ringworm can turn pretty nasty. It tends to spread like wildfire in cats. It can spread to the other cat.
Well, that's a good one.
Oh, look at that.
Now we're worried because this can spread to us. It's a zoonotic infection. So we should probably clean up, put some gloves on. So let's take all the precautions.
Gloves it is.
So we're giving him a fungal bath. So we're using a special antifungal shampoo and just rubbing that onto the areas for about 10 minutes.
You're so good.
There is the place to play soccer.
So I'm going to clean all around his head. It's quite interesting because actually it's spreading on all the areas he's scratching with his back foot. So I think he's actually scratching one spot and then spreading it all around his face and neck.
Although the special shampoo will help soothe Mickey's badly inflamed skin, he's not looking too impressed.
When we had the light just shining on his claws and his paws, they were glowing as well. So that's probably where he's spreading it from.
So we'll let the medicated shampoo on now for 10 minutes, and now we're going to pop the cream on. It's a fungal cream, and that's going to help clear up that fungal infection a lot quicker.
Okay, let's go tell Mum the bad news, huh?
Oh, wow. Hector, don't you look good, mate?
On the Gold Coast, Hector the Cockatoo has recovered well after Gerardo removed a metal ring that was cutting into his leg.
Look at you, walking around, using that claw. Good boy, Hector. I could see him moving around like as if he had no injuries at all. So I'm super happy with the result. I think it's time for you to go home. What do you think?
Sisters Anna and Lily are waiting anxiously.
It's okay. Let's go.
I have to call and I have to say, how is he going? Because Mum's still like, can you please find out?
Yeah, even she wasn't herself.
She said, I hope he doesn't die. And I said, Mum's not going to die.
Yeah.
Hey team, here is Hector.
I'm so excited. Hello, baby. Hello, baby. You've been a good.
He's been a very well-behaved young man. Once he woke up, he's clawed up out of here, crawled along here, and was clawing up the cage.
Okay.
With no more pain from the tight ankle ring, Gerardo is confident Hector's nervous feather plucking will now stop.
Is that better than it was before?
Yes, absolutely.
Whoa.
Oh. That's actually a good sign.
No, it is a good sign.
Oh, Hector, you pick your moment.
Cockatoos live for 60 years, sometimes longer. That is a multi-generational commitment.
So we're going to see Mummy now.
I know that he is going to be loved for decades to come.
We're going to go home now
Oh,
then?
he's like, yeah, give me home. I'm hungry.
Thank you. You're a
Hallelujah.
godsend.
Look at that lesion.
Audrey and Alison have just discovered ringworm is the cause of Mickey's badly inflamed skin. They're now concerned the highly contagious fungal infection could have spread to Mickey's housemate Rubens.
You can see he's quite wet and he looks a little bit oily because we washed all the lesions and we actually popped a cream on.
Okay.
The first test we did was shine an ultraviolet light all over his skin, and what that looks for is fungus. So if he has got fungal lesions, they'll tend to glow an apple green colour, and he was positive all over. And that's a classic ringworm. It also means that I need to check Rubens to make sure he hasn't caught it.
Good luck with that.
So Reuben, the other cat, is sitting there really nicely on the chair, looking really chilled. But we know Reuben, and he can be quite feisty. So it's actually going to be a challenge to do this test.
19-year-old Rubens does not like vets.
What do you think the best way is for us to approach him?
I think just the two of you get in there and just do the tough love. You know, one holds him one end and the other end, because he's he's not going to like it.
Oh, Rubens, it's okay. We're just going to shine a light on him. Okay. Oh, we're still paying. So Reuben isn't as nice as you think. He's putting up a bit of a struggle. He's growling, he's scratching.
Ringworm is highly contagious, so despite his protests, the girls are determined to thoroughly check grumpy Rubens.
Oh, Rubens. Reuben's looking pretty good. We can't see any glows. We've checked the whole surface of him.
Rubens.
So clear bill of health and no fungus there. Thank you. Bye-bye. A big part of treating the cat is also treating the environment. Because these funguses release spores into the environment, anyone can pick it up. So we need to give it a really good vacuum and also wipe down the surfaces you can. With diluted bleach is probably the best option. So really good vacuum of all the areas that Mickey lies in.
Yeah, great. Extra housework.
With regular treatment, Mickey should be ringworm-free in a few weeks.
Hey Ash, what you got there?
This is
Simba.
Simba.
Simba likes to chew on things.
Oh dear, that's
He
never
likes
good.
Daddy's woolly socks.
His socks?
Yeah, and he's had a few vomits.
At the emergency hospital on the Gold Coast, Alex has found herself at the centre of a missing sock mystery.
Oh dear, that's not a good start.
The culprit is a grumpy Burmese called Simba, brought in by worried owners Shane and Kylie.
This morning I was out at the supermarket getting groceries and Shane's given me a call and he said, our little fella's not good, something's not right. And he's notorious for playing with a pair of Shane's woolen socks. So Shane's gone out this morning and noticed that some of the sock is actually missing. We don't know whether he's eaten something, whether he's...
Just not himself.
Yeah.
You know, this morning he was, gets up, he's bounds around and we tried to pick him up and he's meowing a bit. So we're like, yeah, something's definitely wrong.
I just get some vital signs to start with.
But now Alex has to try to find out if Simba is guilty or just grumpy.
When cats behave like this, it can be an indication of pain, but it's also possible that Simba just doesn't want to be at the vet's today.
I can actually hear him growling. So I feel like this is not going to go very well, Simba. Hey? Problem with cats like this, they've got like a tolerance point. Once we get past that point, he's going to explode, I reckon. Okay. I think what we might do before we go any further is probably just get some sedation on board before he gets to that threshold. Give him a chance to chill out, and then we'll figure out a plan.
Good boy.
Done.
Oh, so great.
Good boy. If Simba has eaten his dad's sock, it's very serious. We could be talking about emergency surgery here. Oh, mate. What are you going to do today? You're going to find it hard to find that sock if you're not going to be happy with us.
Okay, and we're here.
In Sydney, Audrey and Alison are on their way to visit a very special menagerie.
Here we go.
Brother and sister David and Christine have huge hearts when it comes to animals in need.
Good boy.
We've got Jakey, Danny, Cody and Gracie the cat. 3 of them are 15 and 1's 8. Love it, they're family. They all need individual walks, diets, attention, different personalities.
You get people coming up to say, have a look at the baby, and then when they see it's Cody the dog, they're kind of like, oh.
Hi, Christine. Hi, nice to see you again. Hi, David. Christine and David have hearts of gold.
They've taken on all these animals. They all have complex medical needs and they just give all their love, attention and time to these animals.
There's nothing they wouldn't do.
Hey, Jakey.
Today, the girls are here to treat elderly Jake.
Jake's a 15-year-old golden retriever. I've been seeing him for a couple of weeks now and he's just got a non-healing wound on his leg.
You've been so good just sitting here letting Auntie Audrey do her thing.
He was walking up and down the stairs and he kept knocking it on the edge of the stair. He has got bad arthritis in that left leg.
So we just want to have a look how it's healing today. Pretty much every visit has been getting better and better. The wound's granulating well. Not all our patients will just sit here. He's definitely one of a kind, isn't he? You're welcome to sleep if you want.
So that's healing really nicely. And that's actually shrunk. So the skin is now starting to contract into the granulation tissue and grow across.
And that pink tissue is actually what we want to see. The more red and bleedy, the better it is. Yes. So we'll give it a clean up and then we might do acupuncture therapy on it.
Yes.
Here. So we'll swap places now. Okay. My turn. I'm using a combination of laser and electroacupuncture. What we do is a little technique called encircling the dragon, where we put points all around the lesion, sort of in a circle, and hopefully that should speed up healing.
Is Jakey going to feel that?
No, it's just going to be like a little bit of a tickle, sort of a pulsation, a bit of a warm feeling. It's very relaxing. I feel like I'm going to fall asleep.
I think
he gasped.
He gasped.
Oh,
no.
Oh, Jakey, that's...
Jakey! Woo! What did you have for dinner?
Obviously, he must have had an upset stomach that made it embarrassing.
Thank you. You're faffing it my way.
We'll bandage up that leg now. I'm going to pop some Manuka honey on there first, because that's great for healing and it's also antibacterial.
Wants to be the center of attention. It's not happening.
All right, last layer, Jakey. What do you think about the orange bones? Jake!
Doesn't like it.
Well, Danny approves. Here you go. One more magic touch with love. All right, Jakey.
All done.
All done. Let's see how you go walking on that bandage.
Having the home visits from a mobile vet is fantastic, particularly for having older animals.
Good boy.
Well done.
He's now well and truly on the road to mend.
It's been very good, well behaved for us. Yep, time for a nap, I think.
Bye, Jakey.
Bye, Jay.
See you next time.
Okay, puppy time. Today I'm coming to see a couple of really good friends of mine and I can't wait.
Jess and Adrian are together thanks to matchmaker Danny.
Danny approached me and told me about this fabulous man she knew and that she thought we would be well suited.
Hello, gorgeous girl, how are you? Good, how are you? Good.
Now Jess and Adrian have a new little addition to their family.
Nice to meet you too. Oh my gosh, you're the cutest little puppy. And hi, sorry.
Hi, how are you?
Good. Oh, you are the cutest little man, hey? Yes, you are. I am so thrilled seeing the two of them so happy together, and now they have this gorgeous little fur baby and they're this happy little family. Hello, oh hello, oh hello. So today I want to do a bit of a health check and get his vaccinations up to date. Let's have a little look in your mouth. Hey? Oh, you're a little nipper. Just have a look in there. Boy. Oh, beautiful, beautiful. Let's have a little listen to your heart now, mate, hey? Good boy, good boy. That all sounds fantastic. Good boy, hey? Just having a little feel of his patellas, just making sure that they're not luxating, that they feel good.
So is there any health issues that we need to be considerate of with mini dashies?
Yeah. Unfortunately, the big thing that they get is invertebral disc disease, so spinal issues. It doesn't tend to present till they're sort of 3 to 5 years of age, so nothing to worry about in the short term, but certainly being mindful of that, not having him jump up and down from heights and that sort of thing is good.
Good boy.
Today I'll be giving Enzo his 10 to 12 week vaccine, and vaccines are really important because it protects them from various infectious diseases. First component is just an oral vaccination, so I'm just going to squirt it into his mouth.
Yep.
Okay. Oh, good boy. Well done. I'm just going to give you a little needle now, mate. Sorry, pup. All right, so lots of distraction up the front. Oh, so brave. So vaccination's all done. So where are we up to with parasite control?
The breeder said that he'll be covered up to 8 weeks.
It's really important that all puppies and dogs have parasite control on board. I would recommend we use the product that's going to cover your fleas, mites, most of your intestinal worms and heartworm, and they're the big problem parasites that we need to deal with. And you just need to dribble this onto the skin, so just part the hair and make sure it's getting straight onto the skin. Oh, darling. Here's to Enzo and his first little health check.
Cheers.
Cheers.
And here's your matchmaking skills.
Oh, thank you, I'll take that.
Yeah, not bad.
Right, let's check on your little man. How you going in there? You chilled out a little bit? Hey, are we going to be friends now?
Alex is still trying to get to the bottom of a mysterious missing sock and needs to find out if 8-year-old Simba is the culprit.
Simba spent a lot of time in hospital when he was younger, so he is not a fan of vets. And Shane warned me he can go from 0 to 100 in the blink of an eye. So we've decided we're going to do all of the diagnostics while he's asleep.
Hey, mate. You're a bit more friendly while you're sleepy. Yeah.
Isn't he beautiful and soft? Now we can actually
Touch him.
touch him. You're not completely asleep, are you, Simba? In general, cats are pretty sensible with what they put in their mouths, but Burmese do have a reputation, so the possibility that he has eaten something, it's there.
I can hear you purr.
Yeah. I'm not sure it's purring. I reckon he's swearing under his breath at us, actually.
Alex first wants to do an ultrasound. to see if the sock shows up in Simba's intestine.
Oh, mate, that beautiful coat of yours. It's all got to go. It'll grow back. An intestinal obstruction in an animal can seriously damage the bowel. It can be life-threatening. All right, let's have a look. So if it is a sock, especially a big woolly sock, chances are we're going to see it on the ultrasound. We're looking for any evidence of what we call dropout, which is where the ultrasound waves can't go through, and that can be an obstruction, an object, a sock or something else. Okay, well, I'm not seeing anything. I don't think there's a sock in there. So the ultrasound's clear, which is good news. There's nothing that I'm seeing that looks like a sock or any other blockage. I think we should do an X-ray, just to be sure.
Yeah.
All good? Moment of truth, Simba. Not seeing anything that worries me too much. All right, we know there's nothing on the X-ray, so what we don't know is exactly what's wrong. I think we should check him over for a tick.
Yeah.
Do you reckon you could go all over him?
Sure.
Yeah, run your hands over him, just go from end to end, just make sure there's no ticks there anywhere. We're always worried about ticks in this part of the world, and Shane and Kylie did mention that Simba had had some raggedy breathing.
I can't find anything.
No?
No.
Okay. All right, it was worth a look for sure.
Yeah.
But I reckon let's get him back to bed and wake him up.
Yeah, no worries. Come on, buddy.
Simba doesn't have a blockage, but I still don't know what's wrong with him. Caitlin, just watch him when he wakes up, and I know that he's going to be too happy once he's awake.
In Bondi, Kate has good news for Sarah. Rufus has been cleared of Addison's disease, and there's no sign of a urinary tract infection.
He is so much better. He's not straining.
No.
Great.
No.
And he looks like he's back to his happy little camper.
Yes.
Hope to see you again, but not too soon. Okay? I know I love you. See you later, little alligator.
Thanks so much for everything.
Come on, Rufy. Yeah. Come on.
Hey, matey. You awake? Hey, buddy.
Burmese Simba is now awake following his ultrasound and X-ray.
Well, it's good news that you didn't swallow the sock. That's a relief.
Simba seems less than impressed that he was blamed for Shane's missing sock.
Simba's brighter this morning. He's had a little bit to eat, and I think he's ready to go home. I'm really looking forward to reuniting Simba with Shane and Kylie. Hey guys, got someone here who's very much looking forward to seeing you. He is their baby, and they really missed him last night. He's lost a bit of hair on his tummy, but it'll grow back. That's where his ultrasound is. Oh, you're holding on, mate.
Hello. Look at him with his little shaved belly.
Really lonely at home, wasn't it?
Yeah, we felt really like
odd
that
going
third
home
family
with
member was missing.
And you feel like you hear a noise or something every now and again. You're like, oh, that's him. And you're like, no, it's not him. Yeah, he'll get a lot of love. A lot of love, won't you?
He's obviously done well with you guys because honestly he's in a lot better mood. So well done, Alex.
Yeah, no, he was a champion, so yeah. Take him home.
Right,
Give him
mate.
lots of love.
Yeah, thank you.
Okay? The main thing is that we ruled all those things out. So the mystery of Shane's woolly sock continues, but at least we know it's not in Simba.
Dan to Tim. I got Hugo right at the gate. If you could bring that van over, that'd be great, mate.
At the Australian Reptile Park, it's a big day for Hugo the tortoise.
Roger, Roger. See you in a minute. Hugo is a Galapagos tortoise. Now, he looks healthy and fine, but our best indicator of health is to weigh him. That's not easy. We need industrial scales like that at the vet for weighing large animals. So we have to take Hugo to the vet at least once a year. Galaps are really intelligent. And it's fair to say that Hugo doesn't really like the process.
He spotted me. Yeah, mate, he's trying to head away now. We better do this quick.
I saw him freeze.
Yeah, he froze and he's like, oh no.
It's all right, buddy. It's all right. Well, he looks good, mate.
Yeah, exactly. Monitoring that weight and also too his size in general is just the best way to judge if he's truly healthy. But to me, he looks spot on.
He looks good.
For an old man.
Now the challenge starts. We've got to lift this lump of a tortoise into the van. Are you limber?
Was that
I'm already ready.
Murph Hughes style?
Hugo is 70 years old. He could max out at 200 years old and 260 kilos.
Mate, he's off, mate. We better go. We
Look
better
at
go.
him.
He's quick. He's quick. This is it.
Okay,
all right,
ready?
Yep. One, two, three.
Let's just try and get him close.
Tim needs a plan B if he has any chance of moving heavyweight Hugo.
Things might get messy today.
Gerardo's now on his way to help out mate Carl with one of his Newfoundlands.
Good girl. Carl has a big problem.
Clover is the teenager, the adolescent. She's high energy, high spirited, and all she wants to do is play all day long.
Hello, big shaggy waggy.
She's only like about 1.5, so not very old, but when you see her, she's distinctly bigger. And you're like, Clover.
How do you go with the slime, the drool?
I just don't wear my work clothes around her.
Immediately, I can tell that Clover has a problem. She is indeed overweight. Does she steal Willow's food, or?
Oh, absolutely, yeah. And she just eats at such a fast pace as well. Like, you know, she woofs it down.
Whoa, I've got kisses. If she remains this way, she's going to develop degenerative joint issues in the future. Have a feel of Willow. Significantly different, right, hey?
Definitely different.
And when you look from the top down, Willow has like a nice waist.
Yep.
Clover's a bit straight. One thing that people commonly do is just reduce their food. And the reason that's not so good is because it may lead to nutrient deficiencies. It makes them more hungry, and it actually makes them beg more, so they get more annoying, more slobbery, might even start eating things in the garden just to fill their stomachs.
She's eaten a rock already.
Did it come out, or?
No, that was a very expensive visit to the vet.
Well, I can imagine. Now that we have determined that Clover is indeed overweight, I've got something special for her. It is specifically designed to turn up the metabolism and activate fat-burning pathways, which will help shred Clover's weight and get her back on track. Okay, I don't think we have any issues.
Eating it is not a problem for her. So we'll actually make her feel fuller?
Yeah, it actually does make them feel
Yeah,
better.
she's already going for the bag.
Hey?
She's looking for the ones you dropped.
Very nice to meet you, but I think I've had enough of your slobber too. I need to go home and have a shower and a change of clothes.
One, two, three.
Let's just try and get him close.
At the Australian Reptile Park, Tim and his team are struggling to lift massive elderly tortoise Hugo.
Can you give us a hand for a minute?
It's obvious after the first lift, this is too heavy for 4 people. We need help. Just take some weight.
Let's make this quick, guys.
Ready? We'll just get him close, turn him around. 2, 3. Up. Yep. Back door shuts it.
Yep.
Heavy. I don't remember him being like that. He's in. We have to get to the vet now. You know, I can feel Hugo in the back. Unless it's you, Coop.
Old string bean there.
I can feel him. I can feel the whole weight.
Just the weight in the back?
Yeah.
Yep. Unbelievable.
Hugo will be weighed at a nearby animal hospital. That's if the 70-year-old cooperates.
So we'll slide him out. When you can get a hand on, just get a hand on. With 6 of us, Hugo's weight is distributed but it's still very heavy and it's very awkward. Let's just go out and down. Our preferred option is to put him on the ground and lure him with some food so he walks himself. Well, if he doesn't go in, we have to lift, but that's a long lift and it's not easy. I think he's looking at Gabriella's plants. Hugo's not playing ball. He didn't get the message. He doesn't want to walk. 1, 2, 3. Lady's right there. We have to do it. We'll just take him all the way into the scales. That's it. Okay, all off. Eventually we get him on, but then the surprise comes at 176.9. A couple of kilos down.
It's a bit interesting, yeah. Yeah, from the last official weighing.
Yeah. He's actually lost some weight, about 3 kilos. That's the first time in history he's lost weight.
Seasonal change, maybe. Fluid, fecal, all those things come together.
Yeah. Well, that's why we weigh him. Come on, big guy. Let's get you home. 1, 2, 3. Yep. Hugo's lost 3 kilos. It instantly sparks a concern because he's never done that before.
Front on. Just watch those front legs.
But when you weigh 170 plus kilos, that's a really marginal fluctuation. So we'll monitor that. Instead of coming back to the vet in a year, we'll come back in 3 months. Otherwise, he looks tip-top. 1, 2, 3.
You all right, good? Big boy. All right.
Right, I'm going to leave you with it.
All right, thanks, Tim.
Job well
Appreciate
done.
it.
2 weeks later, Hector the Cockatoo has fully recovered after having a tight band removed from his leg. With Simba in the clear, his owners report there's still no sign of that missing sock. And it's good news for tortoiseshell cat Mickey, with his nasty ringworm now under control.
Oh, you're looking so much better. Let's take our medicine. Down the hatch. Beautiful.